Persistent heartburn, unfortunately, is one of the main symptoms. So a lot of patients will present with difficulty swallowing, and when going into their medical history, you ask them the question, so have you had any reflux in the past? And a lot of them will say, or the majority of them will say, yes, I've always had reflux.
Lots of people do think that indigestion is quite a common symptom, and it really is. I think that something like 1 in 4 people suffer with indigestion, so it's something that we all experience, or lots of people experience throughout their lives at some point. If the symptoms are persisting for a long time, so we're saying more than 3 weeks of length of symptoms, or the medication isn't working at some point during those 3 weeks, we'd really want to see them, because actually that's a warning sign to us that there's something going on and we need to get it checked over.
And one that's later on is regurgitation of food, which you can get also with persistent reflux. These are not normal, so getting them checked is absolutely essential.
We don't want well people to be overly worried by symptoms that everyone gets now and again. If you have a curry on a Friday night and a couple of drinks, you might get some heartburn the next day. That's pretty normal, and it's not something you would go and see a GP for.
The anti-reflux medication that you get off the shelf, it suppresses the symptoms, and they think, oh, it was just that food, or maybe I'm put on a little bit too much weight and it's that's causing the symptoms, which it will. Sometimes taking the medication can sort of mask what's really going on.
If that is every day, if that is every day for a week, okay, starting to get worried. If it doesn't go away for 2 or 3 weeks, that's not normal. And that is something that does need to be investigated, or at least checked out. It's also not normal if someone has already been investigated for acid reflux, if their symptoms then change, and that should also be looked at. So it's about duration, it's about severity of symptoms, and it's about changes in symptoms.
The other things we'd strongly encourage people to come for early on are if you're losing weight, but you're not really sure why you're losing weight, and any difficulty in swallowing, because we know that's not usually normal, and actually if that you're struggling to kind of eat or drink any of your foods, and we'd want to see you early on.
Go and get checked out. Don't be afraid to go and ask, because, you know, best case scenario, absolutely everything's fine. But if you've caught it early, that's when they can get control back and try and make a difference.